Okay, so here's going to be a basic video of the anatomy of the heart. And first, I'm going to start by explaining how the process works in general. And then we're going to go over some of the details that I missed about different structures. And then we'll talk about the coronary arteries and the coronary veins. So before we start, let's go over some basics. So the heart is basically going to filter deoxygenated blood and turn it back into oxygenated blood for our body to use. And pretty much cellular respiration is going to use oxygen to produce ATP, and in that process, blood is going to become deoxygenated as oxygen is consumed and carbon dioxide is released. So, deoxygenated blood is going to enter through the inferior vena cava and the superior vena cava into the right atrium. From the right atrium, deoxygenated blood is going to go through the tricuspid AV valve into the right ventricle. From the right ventricle, during ventricular systole, so when the ventricles contract, that blood is going to be ejected through the pulmonary semilunar valve right here into the pulmonary trunk and then into the two pulmonary arteries here and here. Now, from the pulmonary arteries, that deoxygenated blood is going to go to the lungs and it's going to be infused with oxygen from the alveoli, and it's going to return through the pulmonary veins right here. It's going to enter through to the left atrium. From the left atrium, oxygenated blood is going to go through the bicuspid or mitral valve into the left ventricle. From the left ventricle, oxygenated blood is going to be ejected during ventricular systole. So when the ventricles contract, that blood's going to be shot from the left ventricle right here to number 30. So number 30 is going to be the aortic semilunar valve. It's going to go straight to the aortic arch, the ascending aorta, and then to the descending aorta right here. Now, there are a couple of different branches here, and the reason for that is because oxygenated blood doesn't go to just one part of the body. It's going to go to various parts of the body and eventually the entire body. So it's going to happen through the brachiocephalic artery, the left common carotid artery, the left subclavian artery, which is going to branch into the internal thoracic, the musculophrenic, etc. Every single branch is going to have multiple other branches to supply the complexity of our body. So over here, if we follow this is going to be the descending aorta, the thoracic aorta to supply the thoracic wall, etc. One important thing to notice, when I talked about the inferior vena cava and the superior vena cava, notice that I did not talk about this being the superior vena cava. These are going to be brachiocephalic veins, which branch into internal jugulars and subclavian veins. When the two brachiocephalic veins meet together, that's when we call it the superior vena cava. So superior vena cava, left brachiocephalic vein, right brachiocephalic vein. Here's going to be the entrance for the azygos vein, which is going to be important for the thoracic wall and a ton of other areas. But as we continue, let's go on to a couple of the structures that we did not mention yet. So on the right atrium over here is going to be the crista terminalis. Number 24 right here, that's going to be the fossa ovalis. Now before birth, we call this the foramen ovale, which is going to shunt blood from the right atrium to the left atrium before birth to bypass the lungs. If you notice up here, number 12, that is going to be the ligamentum arteriosum, or before birth called the ductus arteriosus, which is going to similarly shunt blood from the pulmonary trunk to the aorta in order to bypass the lungs during birth. Now, a couple more things. What is this right here? This line is going to be between the two ventricles. It's called the interventricular septum. If we look at the tricuspid and the mitral valve, or bicuspid valve, we're going to notice these strings. These strings are called chordae tendineae, and these strings attach right here onto this bulb-shaped muscle, which is called papillary muscle. Now, extremely important for any type of exam. These bulb-shaped muscles right here and right here that attach to the chordae tendineae are papillary, but the ridges inside are going to be called trabeculae carneae. So trabeculae carneae, papillary, chordae tendineae. Now, similarly, if we look at the atrium, there's going to be muscle on it as well. So look at the right atrium. These ridge-like cones are going to be called pectinate muscle. Now, that's it for these structures, and let's continue with a few more things about the veins. So, this structure right here, going over the right atrium, the right auricle. Over here, left auricle. Now, a couple of important arteries. So, let's start here. This, going under the right auricle, is going to be the right coronary artery. It's going to branch into the right marginal artery. And if we follow the right coronary artery from up here all the way to the back, it's going to be called the posterior interventricular artery. So right coronary artery all the way to the back to the posterior interventricular artery. Now, The left coronary artery, unfortunately, is going to be under the left auricle, but it's going to be a lot smaller, and as soon as it bifurcates, we're going to change the name. So left coronary artery, first bifurcation, is going to be the anterior interventricular artery. Now, going here is going to be the circumflex artery right across here, and then this branch is going to be called the left marginal artery. Now, let's go into the veins. Right over here, this big bulge is going to be called the coronary sinus, which is where the cardiac veins are going to drain into. So coronary sinus is here, and if we follow the coronary sinus onto the anterior portion of the heart, we're going to be coming right here to what's called the great cardiac vein. So this vein all the way up here, going around, is going to be the great cardiac vein, which is going to go into the coronary sinus. Right here, middle cardiac vein. Right here, small cardiac vein. That's it for the heart.